Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Central DI, and we are looking at its causes. So the first one being, we are going to look at neoplasms. So under neoplasm, it can be due to the pituitary adenomas, and also the meningioma, next it can be due to the metastasis as well, and metastasis is basically from the lungs and the breast cancers. Then comes the infiltrative. So under infiltrative, there can be sarcoidosis as well as the Langerhans cell histiocytosis. Sarcoidosis as well as the Langerhans cell histiocytosis. Then comes the genetic. So under genetic, there is a Wolfram syndrome. Wolfram syndrome, as well as there is a Hand-Schuller-Christian disease. Hand-Schuller-Christian disease. Now let's move on to the infections. So under infections, it can include the chronic meningitis, and there is also the viral encephalitis, and the toxoplasmosis. Then let's look at the inflammatory. Inflammatory, it includes the granulomatosis with polyangiitis. So there is granulomatosis with the polyangiitis. Then comes the lupus erythematosus, the lupus erythematosus, and the presence of the scleroderma. So all these are causes of the central diabetes insipidus. Then there can be some vascular causes as well. So under vascular, there is Sheehan syndrome, as well as the aneurysms, that is the internal carotid. So there is presence of aneurysm, that is a internal carotid. Then there is head injury. So this head injury, it can be closed as well as penetrating. So it is closed as well as penetrating, and it includes the pituitary surgery. And other causes is, it can be due to snake bite, and it can be due to the lymphocytic hypophysitis. Lymphocytic hypophysitis. To learn and grow daily like this, please do subscribe.